We live in a highly interconnected and globalized world where not only people can be anywhere in the world in a matter of hours, but also the diseases that they carry. And that's in particular relevant for infectious diseases that can be transmitted from person to person. And the most recent and most prominent example for this is the ongoing COVID-19 pandemic, where public health policymakers are confronted with choosing the most adequate and most effective intervention to tackle them in a very short time. Another major public health concern that has been a bit overshadowed by the COVID-19 pandemic are infections caused by antibiotic-resistant bacteria. Transmissions by these bacteria are especially critical for hospital patients that represent a very vulnerable population of our society. And mathematical models have become an essential tool to react to these challenges. They help us to better understand how infectious diseases spread, to predict their future behavior, and finally to help us to find the most effective intervention to tackle them. And they allow us to translate our understanding how infectious diseases spread into a mathematical framework, and we can then compare the results of this framework with observations in the real world. In my PhD thesis, I developed various types of mathematical models to evaluate the impact of interventions on infectious disease transmission, and I specifically focus on COVID-19 and Pseudomonas aeruginosa. Pseudomonas aeruginosa is known as an antibiotic-resistant bacterium that is especially dangerous for people with a weak immune system, such as patients lying on intensive care units. My thesis can be roughly divided into two parts. In part one, I developed mathematical models to link the biological process of infectious disease transmission with health-related behavior of people. We showed that if people voluntarily adopt preventive measures such as hand washing, mask wearing, or physical distancing, as a reaction to an ongoing COVID-19 epidemic, the epidemic itself can be mitigated and delayed. And if these measures are adopted very fast and the efficacy of the measure itself is very high, then a large outbreak can even be prevented. We then studied hand hygiene, specifically as a measure to reduce viral respiratory tract infections, and showed that it can be optimized by how often and when you apply it. In particular, we showed that washing your hands immediately after they've become contaminated is much more effective than washing your hands regularly at fixed time intervals. In part two, I developed mathematical models to control the spread of infectious diseases in hospital settings. We modeled various transmission routes for Pseudomonas aeruginosa, for which it's known that the environment may play an important role. We therefore specifically included environmental contamination as a transmission route and showed that it can cause outbreaks in intensive care units, but its exact contribution is very dependent on the specific setting. To inform infection control strategies in hospitals during the current COVID-19 pandemic, I have contributed to the development of various mathematical models to study infections in hospitals caused by SARS-CoV-2. For hospitals, it's very important to know whether a COVID-19 case was already infected when they came to the hospital or whether they got it, so acquired it, during the hospital stay. During the first wave of the COVID-19 pandemic, a lot of hospitals defined the hospital-acquired case as someone who had a symptom onset more than 7 days after admission. And we showed that by using this method, a lot of hospital-acquired cases may remain unidentified. On the one hand, patients may be already discharged before this cutoff, so they may be missed, or they may have their symptom onset before this cutoff, so they may be misclassified as a community-acquired case. That's why screening or quarantining patients when they are discharged may be an effective intervention to prevent further transmissions in the community. We also showed that the use of highly effective personal protective equipment in all hospital wards was likely one of the most effective interventions to limit SARS-CoV-2 transmissions in hospitals during the first wave in the Netherlands. We also showed that contact tracing can not only be useful in community settings, but also in hospital settings, because their proportion of detected infections among tested individuals is much higher than, for example, for screening interventions. To summarize, my thesis highlights the value of mathematical models to tackle infectious disease transmission, and they can be essential not only for newly emerged pathogens like SARS-CoV-2, but also for old problems like the transmission of antibiotic-resistant bacteria.